morning, everybody. I would like to present you measles situation, epidemiological situation in Ukraine. I think it's a very important problem for our region and for neighboring countries, because we have outbreaks, a lot of outbreaks in Romania, and a lot of outbreaks in Ukraine during this year. So last measles outbreak was registered in Ukraine in 2012 with incidence rate more than 25 per 100,000 population. It was a huge outbreak, and more than 12,000 cases were registered in Ukraine. And during 2013-2016, MMR vaccination coverage gradually decreased due to lack of vaccine. Let me explain what is lack of vaccine. There were some problem in procurement system of our country, and due to this situation, country has lack of vaccines. And in January, August of 2017, number of measles cases in Ukraine increased, and incidence has reached 3.8 per 100,000 population. And in previous year, incidence rate was 0.01. In this slide, you can see a graph describing our situation, measles situation last 6 years. You can see a peak in 2012, as I mentioned earlier, and red line, this is vaccination coverage. Unfortunately, vaccination coverage gradually decreased, and you can see in the end of horizontal axis increasing of measles incidence in Ukraine. We don't have right now the number, the vaccination coverage of this year, because this year is still ongoing. But I would like to mention that we started the supplementary immunization according to WHO recommendation. So in this map you can see distribution in Ukraine of incidence. In red highlighted two oblasts, Odessa and Ivano-Frankivsk, with high level of incidence. And you can see the figures of incidence in Ukraine. And here we have to mention that the neighboring oblast with Romania has a high level of incidence. What was the objective? It's to describe the epidemiological measles situation in Ukraine, to identify potential risk factors of outbreak of measles, and to elaborate appropriate public health measures to solve this problem, to mitigate risk of outbreaks in Ukraine. Methods we used this first descriptive method, and data analysis using Microsoft Excel based on database of national report forms, and also we use national case definition. National case definition is approved by Ministry of Health, and for measles it's the same as European Union case definition. We have probable cases, it's clinic confirmation, possible cases with those persons who have epid linkage with persons, and confirmed case, this is clinic and laboratory confirmed case. According to our legislation, we need to confirm, in case of outbreak, we need to confirm at least 1-2 cases, laboratory confirm. Results. In this table you can see age structure of cases in 2017 during January, August. And here you can see that most cases was age from 1 to 9. Next slide shows vaccination status. Unfortunately, it's a huge problem for us, and here you can see that non-vaccinated 50%, and unknown, it's equal non-vaccinated 19. And also you can see 2 doses vaccinated children or people who has suffered measles. It is a question also for us, why 13%. But there are some problems with physicians with like paper vaccination. This slide describes a number of laboratory confirmed cases, and in the right column you can see the percentage of laboratory confirmed cases, and you can see this year this percentage more than 50. During this year, 34 measles outbreaks were registered in Ukraine during January-August. And according to Ukrainian legislation, outbreak is 3 and more cases with epidemiological links. And most of cases were unvaccinated. And vaccination coverage constantly decreased during 2012-2017. We calculate incidence rate per age group, and it was highest in age group 1 to 4 years and age group 5 to 9, but I didn't put it in this presentation. Main conclusion is that increasing of measles incidence was due to accumulation of pockets of non-immune population. Recommendation. First of all, to conduct supplementary immunization among target groups, children from 1 to 9 years old. There were WHO recommendation, and this supplementary immunization has started on the 11th of September. Situation with procurement of vaccine has changed, and starting from 2016, Ukraine procure vaccines via international organization. For example, via UNICEF. And now Ukraine has enough vaccines to conduct this supplementary immunization. Second one recommendation is to capture all suspected cases into surveillance system, because one of limitations in our study was some underreporting, because physicians don't want to register to report, and they put another diagnosis, but not measles. And to solve this problem, we decided to conduct cascade trainings, and this trainings has started yesterday. All oblasts will be covered by these trainings, and trainings, a main objective of these trainings for physician, epidemiologists, laboratory specialists is to raise awareness among staff, among medical staff, among laboratory staff, and also raise awareness among parents in vaccination issues. And my acknowledgements for my team who helped me to conduct this study and to prepare this presentation, and also special acknowledgements to WHO expert Usala Lakverdia. Thank you.
Thank you, Roman, for this nice presentation that focuses on very important, actually, diseases, measles, that most of the country try to eliminate and control this disease. Now, time for a question, please. Any question? Yes?
Thank you for a nice presentation. My name is Dr. Yasser. I'm from Palestine. My question is, in the first two slides, you showed that the vaccination coverage is more than 90% and you have the outbreak. And after that, the coverage is declining, as you said, since 2012 till nowadays. Yes, it's here. So if you show the vaccination coverage, it's almost there at 90%, and despite that, you have an outbreak. How can you explain that? Here, I will put question for you to ask about the efficacy of the vaccine rather than the coverage of the vaccine, because the measles vaccination is highly sensitive to temperature and light and etc. So you should put in mind that the efficacy of the vaccine also, rather than the coverage itself as alone. As you said, almost 50% of the cases were unvaccinated. So I don't believe this much the coverage that you have here. And maybe you have to do more, could be a survey, or you have to expect a huge outbreak, since you have 90% coverage here and you have an outbreak. So what will happen if you have 40% coverage? Thank you.
Thank you very much for these questions. Really, it's a very interesting question. Why did we have outbreak in 2012 when we have sufficient, maybe sufficient coverage of vaccination? I see here a couple of reasons. First of all, measles, it's diseases with wave character of incidence. So we had in Ukraine several increasing of incidents during 2001-2017. First increasing was in 2001, second one was in 2006, and periodicity is 6 years. Unfortunately, regardless of vaccine coverage. This is one reason. Second reason is, as I mentioned, is vaccination on paper. It's unfortunately, it's a problem for Ukraine, but now we gradually solve this problem, because we have anti-vaccination campaign starting from 2007, and we are not sure that this data is correct, but this data from our national vaccination electronic system, UKRVAC.
Yeah, hello, Roman. Senad Begic from Institute of Public Health of Montenegro. So what you've shown here is the coverage in total over the whole country. Is there a possibility that there were certain oblasts and certain areas and municipalities with very, very low coverage, because you haven't showed us the coverage in the lower administrative levels? So what's going on, or what was going on lower levels with the immunization coverage?
Yeah, thank you. The immunization coverage from each oblast was analyzed, and I didn't saw big differences between some oblasts. For example, if we take this red oblast, vaccination coverage was the same as in, for example, green oblast or yellow oblast. This is our data.
Any more questions, please, there? Yes.
Thank you very much for the presentation. I have two brief questions. The first one, did you have any death among measles cases? And my second question, what is the calendar for measles vaccine in Ukraine? Do you give 1, 2, 3 doses, and what are the measles vaccine MMR?
Thank you for questions. Unfortunately, we had death cases in Odessa region. There were 4 fatal cases. And for second question, yes, we have approved by Ministry of Health vaccination calendar, and our children need to have 2 doses of MMR vaccine in 6 months and 12 months.
Yes? 6 months.
Why do you have a dose at 6 months? 6 months of birth, you give measles vaccine?
No, I didn't understand. Can you repeat? I didn't.
So, usually in Ukraine, you give...
You start the vaccination
Oh, three.
Okay, I understand. According to our calendar, we start in 6 months, but our supplementary immunization foresees that every person who have not vaccination need to be vaccinated. And now supplementary immunization, that doesn't matter age. For example, if child has not vaccine in 6 months or in 12 months, and now if he or she is 2 years old, it's not problem. He need to have vaccination.
Yes? No. Let them have time, don't worry.
Thank you for your presentation. I want to ask about the recommendation of supplementary immunization activity. Do you think which better, default or tracing with this low coverage or supplementary immunization activities?
Both supplementary immunization activities, first of all, and contact tracing. Why? Because we need to capture all suspected cases in our system, in our surveillance system. And for my opinion, we need to capture all cases, regardless measles or not measles, because we need to report all cases, because underreporting was in our country, unfortunately. But now we are trained physicians, we are trained epidemiologists, and the main objective is to raise awareness and to ask them to put all suspected cases into our surveillance system, and also with contact tracing.
Any more questions? Yes. Yes, Nicoletta.
Thank you very much for your presentation. I would like to ask you, if I understand well, but please confirm, the way to estimate your vaccination coverage is on an administrative basis, on the reports of the vaccination. You don't conduct a vaccination coverage study. And my second question is, when you are talking about vaccination coverage, you are talking about 1 dose or 2 doses? Because without...
Thank you, Nicoletta. For first question, we have, I'll try to describe our system of reporting vaccination. If child have vaccination, physician need to report to this electronic system, not electronic, but Microsoft Access system. And this data collected in healthcare department, and then they report to Ministry of Health and to Public Health Center. And we analyze this data. And if for this red line, it's 2 doses vaccination, 2 doses vaccination, according to the calendar.
Thank you, Ibrahim. Thank you, Roman, again for your presentation, and especially the theme is very interesting. No, leave it in this slide. I just want to comment this slide. If we see coverage, vaccination coverage rate, it is even before 2010, it is slightly below 90% or just little bit above 90%. To protect against the measles virus, we have to have continuously above 95%, which is not happening in this case, and it's obvious to have measles cases. Also, if we have 95% years, all the time we have a 5% remaining children that they are susceptible for the virus. And having in mind also the nature of virus, which is a very contagious one, the outbreak of measles that happening not only in European region, but worldwide, it's something normal. But this is signal that we as a public health staff, we have to work more on increasing awareness on health staff first, and also we have to work with parents childcare and all others to, to increase and maintain a high coverage rate. Thank you, Roman, very much for
Thank you.
nice presentation.
Thank you, Isma. Thank you, Roman, for this nice presentation.